All right. Hello, everyone. I've noticed that folks are starting to come in. Welcome to this session, a one-stop COVID-19 pandemic response for diverse or urban underserved communities. My name is Nate Weisenberg. I am Program Associate with AAAS in the Scientific Responsibility, Human Rights, and Law program. And I am going to be introducing Dr. Jeff Toney and then handing the mic over to him. So he is a Vice President for Senior Vice President for Research at Kean University. He is also served as representative for Sigma Psi, the Scientific Research Honor Society, on the AAAS Science and Human Rights Coalition since the coalition's founding. He is a background to BS in chemistry from the University of Virginia, MS and PhD in chemistry from Northwestern University. He's also been a visiting professor at MIT and a visiting scholar in the history of science at Harvard University. So with that, I will turn it over to Jeff for the presentation. Just a couple of ground rules we usually like to have. If this is structured as a normal Zoom meeting, if you have questions or comments, please don't hesitate to put them in the chat or to raise your hand, and the panelists will get to them as we're able. Thanks so much for joining us, everyone. And Jeff, over to you.
Hi, Nate. We get into a broader discussion, I wanted to lay the groundwork with our four panelists to give you a broad perspective, very different perspectives of how we as a public state institution came about developing an on-campus COVID testing sites, analysis site, and then ultimately for vaccinations for COVID-19 during the pandemic that we humbly feel could be considered as a model for other universities and colleges, as well as public institutions, to use for similar needs, looking towards the inevitable next pandemic that we all need to prepare for. So briefly, before I begin and introduce my panelists, I wanted to give a warm thank you to our university president, Dr. Lamont Repollet, also to Audrey Kelly, who works closely with the Board of Trustees, who was instrumental in this entire endeavor in terms of connecting us with Union County. Also our Board of Trustees member, Ed Oatman. And of course, Union County Department of Public Health, our liaison was Jessica Cohen. So just briefly, my fellow panelists are Dr. Rob Pyatt, from whom you're going to hear about from the scientific perspective, Dr. Loretta Farrell, who's a practitioner expert in human rights, who will give you the HR perspective. And then last but not least, our student, Selena Edwards, who's currently a senior biology major at Kean and is a shining example of the good work that our students do. So next slide, please. Next slide. So just briefly, when the call for proposals from AAAS came out, I was excited because one of the first things they asked for was how do we propose to present at this important meeting strategies for building collaborations across, of course, science and human rights. The coalition has done a beautiful job of since 2009. In our case, with county and state public health departments. And how do we show evidence that we have successfully advocated for public health during this time of the COVID-19 pandemic? In our case, our main campus is based in Union County, New Jersey. And the county itself and the university, as I mentioned, we believe could be considered a model. For those of you not familiar with the New Jersey tri-state area, our county currently has well over 500,000 residents. About 57% are comprised of Hispanic and African-American citizens. And our proximate town, the city of Elizabeth, is notable for a number of reasons. The port, of course, where a lot of the trade comes in. It's a very diverse population. And unfortunately, there is a significant health disparity compared to the national average. More than double the number of citizens in the city of Elizabeth do not have access to health care. And unfortunately, about 18% are currently at the poverty level. So clearly, the communities that we serve are underserved, very diverse. And this is definitely an opportunity for us to learn and to better serve our communities. So, and if I could just back to the next slide, just briefly, if you'll give me one moment, I wanted to offer a moment of silence to recognize the loss of all the souls during the pandemic, and this affected my own family and friends. So let's pause briefly. Thank you. And may they all rest in peace, and may their memory be a blessing. Next slide. So I wanted to share some data from the COVID-19 racial data tracker that was originally developed through Boston University and was published in the popular magazine, The Atlantic. I encourage everyone in the audience to explore that database. It has millions of data points, demographics of a wide variety, but for the purpose of this discussion, I wanted to hone in particularly on the racial disparity that we hear a lot about in the national news media. But here's some compelling data that shows that when you look at the deaths due to COVID-19 per 100,000 populace, that unfortunately African-American Blacks are affected more than 40% more compared to a Caucasian white population. And you can see the statistics for the other demographics as well. Unfortunately, American Indian, Alaskan Native also are comparable, about 40% higher chance of death due to the virus. Next slide. This is actually hot off the press. Just 2 days ago, the New York Board of Health formally passed a resolution declaring racism itself as a public health crisis. This codifies and really makes sense relative to the scientific data, public health data that I just showed you from the racial data tracker, that this racial disparity plays out in many roles. And in fact, my fellow AAAS Science and Human Rights Coalition member, Professor Michelle DeGraff at MIT, has often said that the COVID-19 pandemic stripped bare racism. Next slide. So you'll hear about over the next 40 or so minutes about the story from different perspectives of our on-campus COVID-19 testing and research center, that it was CLIA certified. And I want to show you a brief video of the superb work that one of our Kane University alumni has done just to exemplify what that on-campus testing site is all about. It's a very brief video. Make sure the volume is up. Please post in the chat box if you're having difficulty with the audio. Okay.
My name is Jose Ben Cosme, and I work in a COVID testing lab. So when you get your nose swabbed, I am the guy that tests for COVID-19. Being on the front line, it's a little intense, I would say. I do remember the first time that I worked in a COVID test and it came out positive. I was really frightened because it was my first time that I actually touched, of course, with gloves, and I tested. But, you know, again, I got reassurance because I was working in a sterile environment. In terms of safety, I feel very safe in a COVID lab. The safety guidelines are very strict. You have to wear personal protective equipment. This includes an N95 mask, lab coats, gloves, and goggles. Everything that's performed using COVID is done under a hood. The way that it works is that it's an air pressure that cleans and filters the air, so your hands are only inside working with the virus and you're not getting exposed because there's a glass shield right in front of you. When the pandemic started, this is actually one of the first things that I thought about. I want to be able to contribute to society and be able to help in the cause. So I am really happy where I am right now. When I tell people where.
Okay, thank you. So as the audience can see, not only is that a significant contribution to public health, but also to our primary mission of providing the best quality education to our students who are coming from those very communities across the state of New Jersey and beyond. So with that, and there will be time for plenty of questions at the end of our presentation. With that, I'd like to pass this on to Dr. Pyatt, who will talk about service pandemic, the clinical diagnostic laboratory story. Rob?
Thank you, Dr. Tony. I am incredibly proud and thrilled to be here today telling you the story of the development of the Kane Clinical Diagnostic Laboratory. And really the theme here that I hope you take through all of our presentations today is one of service during a pandemic. Here you have a beautiful picture of Elizabeth, New Jersey. This is the largest city in Union County where our campus is housed. As you can see in the background there, off in the distance, is the skyline to New York City, showing you we're just a short distance from the big city. In fact, we have a train stop here on campus, and you can hop a train and get to New York within 20 or 30 minutes. In the 1950s, there was a famous TV show called The Naked City that ended every episode with the phrase, "There are 8 million stories in the city. This is one of them." And I think for me, that's a metaphor of what I'm going to tell you today. I'm going to describe for you just one out of millions of stories from the pandemic of how we worked with states, county, and government individuals to service individuals in our area in relation to the pandemic. So I took this screen capture from a database that Union County Department of Health maintains around the pandemic. I did this just a couple of weeks ago. You can see at that time, we had experienced over 16,000 cases of COVID-19, resulting in over 1,700 unfortunate fatalities. And at that time, our transmission rate was just around 1. That means for every person who caught the SARS-CoV-2 virus, they were passing it on to one individual. So a transmission rate of 1 is sort of a steady state of a pandemic where it is consistently ongoing, not increasing, but not decreasing. Thankfully now, just a couple of weeks later, our transmission rate has dropped to around 0.8, and we're hopefully finally seeing the reduction in cases that we've seen with this 4th wave that we've experienced. This is another tracker that you see from our County Department of Health, showing you the number of cases on the y-axis, along with time on the x-axis. So it really gives you a historical depiction of what we have experienced here in Union County during the pandemic. Locally, you can see here on March 2nd, we experienced our first case of COVID-19 here in New Jersey. That resulted on March 18th for the determination to close the university for public health means. Students, staff, faculty were all sent home to then conduct classes remotely. That was followed up very quickly on March 20th with the decision to open a collection site here on campus for nasal swabs to test residents about COVID-19, and you'll hear more about that later on in our presentations. Then following up on that, around August of 2020, it was first proposed that in addition to a collection site, it would greatly benefit the county to be able to develop a diagnostic testing site here on campus. And that's when I joined the cause. So it's important to note the reasons behind why the county decided to develop this testing site. And it really, again, focuses on service. For this testing site, Union County wanted to offer COVID-19 testing to all residents without a doctor's prescription at no cost. Additionally, for all first responders, frontline healthcare workers, local municipal and county employees who currently were not experiencing symptoms, but work in Union County, they also wanted to provide testing. And then finally, for residents, whether they were first responders, healthcare workers who were symptomatic and had a prescription from their doctor, they additionally wanted to provide them testing from this facility. This was all funded then through an act of Congress called the CARES Act. This provided monies, direct payments to Americans who were out of work because of the needs to directly isolate in their homes, money for emergency loans and resources for small businesses, and then relief to hospitals, diagnostic laboratories to develop things like diagnostic tests, vaccines, and therapeutics. This was by far not a solo endeavor that we undertook, and we had partners actually across the country. You see here, as shown in New Jersey, we partnered with Union County Department of Health. We were also working with a couple of other healthcare entities from the state of Michigan, including National Diagnostic Services, a diagnostic consultation firm, and Orchard Toxicology, a laboratory who at that time was already conducting COVID-19 testing. So following up on that then, early in August, we began to evaluate the regulatory requirements of actually establishing a diagnostic laboratory. This isn't as simple as just opening a research laboratory. There are a number of rules and regulations at the government, the federal level, at the state level, and even potentially at the local level that a diagnostic laboratory has to follow. These are all focused around the Clinical Laboratory Improvement Amendments, or CLIA. This was an act of Congress from back in the late 1980s to ensure accuracy in all diagnostic testing. So really what this means is we have to develop our practices, our procedures, our tests that follow these rules, standards, requirements, regulations. So we began that work to develop our lab. Along with that, Kane is a unique institution. When most academic universities were looking to develop diagnostic laboratories, these academic universities had already established medical centers that they could use then to develop laboratories around. Kane was unique in that we don't have that kind of medical infrastructure here. So we were really starting from the ground up. One of the first decisions that had to be made was physically, where are we going to house this diagnostic laboratory? As you can see here, this was the teaching space that ultimately we landed on where we were going to develop the lab. It included not only the space you see in front of you where we have lab benches where students work, some counter space where they would work, but also farther back in the picture, you see traditional classroom space with desks and tables. All of this had to be converted to a facility that was suitable for diagnostic COVID testing. Along with that, since we were starting from scratch, we had basic equipment needs that we had to purchase. Those included things from refrigeration and freezer units like you see on the left, instrumentation to actually extract the viral RNA genome from nasal swab samples, as you see there in the middle. That's a Kingfisher instrument. And then instrumentation to actually perform the molecular biology tests that we would do to detect the presence or absence of viral genome in those samples. And that's a QuantStudio quantitative PCR machine that you see on the right. But our needs went as far as simple plastics, as you see there on the bottom. We were really starting from the ground up in developing this laboratory. And as you know, we experienced supply chain issues during the pandemic, whether that was items that you use in your home, like basic food supplies, basic paper products, but we also experienced those supply chain issues within diagnostic laboratories. Luckily, because we developed this as a consortium, not only of Kane and Union County, but our national partners as well, we could piggyback onto their existing relationship with vendors to ensure that our orders were placed and received by us in a timely fashion. So we began the regulatory process of both the laboratory and myself. I had to go through some certification as well for the state of New Jersey. That started around August of 2020. That was followed up then in early December of that year, where we officially licensed and approved then to offer diagnostic testing. And immediately then we began the process of hiring to bring in the trained technicians we need to perform the testing. As you can see in this article from the Daily Dart, not only in the diagnostic world did we experience supply chain issues, we also experienced extreme shortages in appropriately trained scientists to be able to work at the bench level to process and report out results from diagnostic testing. Luckily, as you saw in the video that Dr. Tony just showed, we were able to leverage our existence as a university for that. You see some of our staff here on the left. We have Paulo. He is a Kane alumni. In the middle, we have Aisha. She's a current Kane University graduate student in our Master's in Biotechnology program. On the right, we have Henry. We recruited him from Rutgers University, who actually was one of our partners in viral sequencing that I'll touch on at the end. On the right, you see Tasmeet, she's our laboratory supervisor, and Aisha in the middle. We were able to recruit them into our laboratory. And of course, on the right, you see Jose, who became the face of our laboratory in a lot of the videos and other media that was presented and developed around our laboratory. He was the star of the video you should have saw earlier. This is just a quick step-by-step showing you a little of the scientific process that we go through when we do diagnostic testing. Nasal swab samples are sent to us in tubes along with paperwork that describes patient information and the test that's been ordered. So we have our technicians receiving those in one portion of the lab. They'll actually scan them in using a barcode scanner, similar to what you'll use in a grocery store. And that will import electronically patient information into our electronic data management system. They then prepare the samples to move into a molecular testing area. You see Jose working there in the second picture, where he's conducting viral genomic extraction to remove the viral genome from any of those nasal swab samples we've received and get it into a form that's usable for diagnostic testing. And that's what you're seeing in that last picture there. Jose working at our quant studio, running our assay or our test to identify whether samples are positive for the SARS-CoV-2 virus or negative. Early this year then, it became apparent that it wasn't sufficient for our laboratory just to be conducting diagnostic testing, just to be seeing our samples positive or negative. Because of ongoing issues with the pandemic, at that point, you can see we were just beginning to come down from the third wave that we had experienced. It became important for any positive sample to actually identify the specific strain of virus that was present. To do that, we again had to pull together a consortium of different groups to help us develop viral genome sequencing. This included the Institute for Life Science Entrepreneurship. This is a biotechnology incubator that's housed here at Kean University. So we partnered with one of those business incubators, MDC, to begin to work with them and Rutgers University to sequence our positive samples to identify the particular strain of virus, while we ourselves developed viral sequencing and then transitioned from our partners to us performing that in-house. And that has led us to where we are today. Up to this point, we have tested over 30,000 samples that have been submitted to us for COVID-19 testing. And I can't tell you how incredibly proud I am of that and of the fantastic staff that I work with. But we want to look to the future and see how we can contribute ongoing, both to our county and potentially nationally as well. That includes, for part of our regulatory requirements, an in-person inspection that will be conducted sometime, likely this year or possibly next year, and we need to prepare for that. We also want to ensure long-term viability of the laboratory. As Dr. Tony alluded to, this isn't the first pandemic that the human race has experienced, and it clearly won't be the last. So we want to begin to work with both our partners within the county and within the state to develop new diagnostic testing for infectious diseases or toxicology to better prepare us to service those various groups that we talked about. And finally, as we're an educational institution, we want to craft educational opportunities for our students. So I'm incredibly excited that during the last year, I've worked with students as part of our Research First initiative. This is a 2-semester course series that our freshmen and sophomore students take, allowing them to do direct, real research with faculty members. So during this time, I've been working with students on data from our Quant Studio assay and in having them analyze viral genome sequence. So once again, thank you so much for letting me discuss the incredible work that we've done, and most importantly, the service that we have been able to provide to our community.
And if I could, I did just want to add one note that due to the good work that Dr. Pyatt and his team did with this testing, that the main driving force early on for us to develop this facility on our campus is that the turnaround time for getting test results was as long as between 5 and 8 days, which we can all appreciate is essentially useless if you have to wait that long to get a result. But after that site was up and running, they could get the results within 24 to 48 hours. And that made all the difference in terms of mitigating the transmission of the virus.
Thank you,
So,
Dr. Tony.
Dr.
I
Pike.
really appreciate that.
absolutely.
And with that, I'm going to pass the baton to Dr. Loretta Farrell. She's the director of our Human Rights Institute here at Kane University. So,
Thank you,
Farrell.
Dr. Pyatt. So while Dr. Pyatt gave you a look into the academic and scientific piece of this partnership, I am really excited to be able to share with you how human rights have tied into it. Kane established the Human Rights Institute in 2008 as the next step in broadening the university's commitment to social justice. Our goal here is to educate students in the greater community about contemporary human rights issues, and also to help them develop the tools that they need to become activists and advocates. We do this in a variety of ways, including our annual Human Rights Conference, which this year will take place on Friday, March 25th, 2022. And we will be exploring the issue of mental health and human rights. So the Universal Declaration of Human Rights specifically established health and well-being and access to medical care and social services as a basic human right for everyone. This commitment was underscored in the United Nations Sustainable Development Goals, which is a blueprint for the attainment of global peace and prosperity by 2030. Goal number 3 focuses on ensuring healthy lives and promoting well-being for people of all ages. Unfortunately, the COVID-19 pandemic has halted and even in some circumstances reversed the progress we've been making toward this goal, with 90% of countries reporting one or more disruptions to essential health services. As Dr. Pyatt previously reported, and as did Dr. Tony, we here in the United States are not immune. A review of the social determinants of health show how unequal access to steady incomes, safe neighborhoods with strong infrastructures, access to education, social services, and of course, healthcare disproportionately impact people living in urban centers and people living in communities of color, such as Elizabeth, which Dr. Pyatt shared, is the 4th most populous city in the state of New Jersey and the largest in Union County, which is where Kane is located. And in fact, our campus, the borders of our campus come right up to the city of Elizabeth. Kane and Union County have had a long history of partnering to support the needs of the residents of the county. So it was really natural when the county was looking to address and mitigate the impact of COVID-19 that they turned to the university, and we of course were happy to help. So just days after the university moved to remote learning and remote work, we opened the testing site here at the university, a drive-through site. It was a drive-through site open to all Union County residents. This short video will give you an overview of how the testing site works and what we're doing here.
Kane and then Union County are working together by testing for students, faculty, and citizens in the area. This is the first county-operated testing site in all of the state to keep the community safe. The most important thing is testing, testing, testing. So if we can provide a convenient testing spot that's open in the middle of the county, it's a win for everybody.
Union County's nasal testing, as well as Kane saliva testing for residential students, is a great way to keep the county safe. Residential students are going to be tested every 2 weeks. The saliva test is very simple. It's just a small sample. It takes a few minutes and they go on their way. The saliva test and the nasal swab, they're both PCR tests. They have a high degree of accuracy. I came to this COVID testing today because it's important as a residential student to be tested in order to secure other students' safety. I was a little nervous about it, but after going through the saliva test and how quick and easy it was, it made me feel very safe.
It's easier for the university to monitor the health of the students and the general health of the campus.
It lets me know that if anything is to happen, Gene's going to be on top of it from the get-go. We do have this Campus Clear app that we log in how we feel. If we feel bad, it tells us to stay in.
All students that live on campus are supposed to use it on a daily basis, and that way the university is able to keep close tabs on anyone that might be feeling sick.
Through contact tracing, we will be able to identify people who are contacts of somebody who tested positive, and get them into quarantine, but also get them the support that they need. If the student needs academic support, if they need counseling or some other type of support, we can provide that to them.
I feel great being back on campus, knowing that I am safe and knowing that there are certain rules and precautions that all students are required to take.
The more people test and the sooner we can identify somebody who's positive, the safer the community will be.
So two things here. When the university first shut down in March of 2020, not all students were able to move off campus. So we did have a residential student population that needed to be tested on a regular basis. We had a significant number of international students, including a group from Wenzhou, China, who were unable to return to home. And unfortunately, we also have some students from the US who just don't have homes to go to. So they relied on the availability of housing here at Kane. And the County of Union made that testing available to our students to keep them safe. As we opened up and more students came back to campus and also interacted with the greater community, it was an important step. That regular testing was an important step in making sure that we weren't transmitting COVID to the outside community. So in an effort to increase access to, would you go back? Sorry, thanks. In an effort to increase access to services, all of our materials, communications, and services were made available in both English and Spanish. Additionally, mobile testing sites were deployed throughout the county because not everybody has a car to be able to come to our drive-up testing site. And there are some people who just physically couldn't get to camp. As soon as vaccines were approved, we opened a walk-in site in Downs Hall on the Kane campus. We bundled services such as bi-weekly emergency food distributions with testing and vaccinations so that we became a one-stop social service agency for the people of Union County. And Kane's student group, Be the Change, worked with the county to provide vaccinations to the homeless who didn't have access to testing or vaccinations. A big part of what we are doing now too is educating people about the importance of the vaccine. It's not a surprise to anybody that communities of color tend to have a fear of vaccinations and medical testing overall. So in order to assuage that fear, Kane's president, Dr. Lamont Repillette, who was the first Black president in Kane's history, joined his colleagues around the state, encouraging communities of color to trust the science and take the shot. In addition, Dr. Repillette hosted a series of roundtables for the greater community, looking at how race impacted the transmission of COVID-19 and what could be done to mitigate that. Finally, I'd like to share with you one of the great benefits that the Kane community has had as a result of our partnership with Union County. And that is that our students have had the opportunity to get real life experience while serving on the front lines of the COVID-19 pandemic. Now I'd like to turn this over to Selena Edwards, Kane University class of 1922. My gosh, she's aged really well, hasn't she? Kane class of 2022.
Thank you so much. So hello. Essentially, I started working at the COVID testing site in November of 2020. And so since then, I've been interning there for roughly a year now. So the reason why I was so passionate about helping out in any way that I could is because I saw the stress that my community was under. And so I really wanted to lend a helping hand. To better give you a visual of all of the work that I did at the testing site, I do have a video prepared for you guys to watch right now.
I had absolutely no clue what was going to happen to me next. Essentially, I think for most of us, we thought that it was only going to be a few months at most, and now it's been about a year, and we're all still scrambling to pick up the pieces. Hi, my name is Selena Edwards. I am a junior here at Kane University. I got an email asking if anybody wanted to sign up to work as an intern for the Kane University COVID testing site. I was hesitant at first, but they were having a hard time finding people. And so I decided that if nobody else was going to do it, I would do it. My job is to be a clinician where I physically swab those who are coming in to get their test done. I was very, very nervous because I wasn't sure what I was walking into, but I was trained very well when I got there. What I want to do with my major is become a neurologist, and I also want to be a travel doctor too. To have an experience like this, I was really able to see what my life could very well look like at any given time. It truly brings me joy to see other people happy and to know that I genuinely had an impact on somebody's life. Right there on the front line in a situation such as this in the middle of a pandemic, it's experience that I would say maybe like once in a lifetime.
Yeah, so as you can see, that's a little bit about what I did. So as you saw in the video, I essentially got an email from my school asking for people to come and intern at the testing site. And like I mentioned, they were having a hard time trying to find people. So I stepped up to the plate and did the best that I could. When I first got there, I was trained very, very well. A typical day for me would look like we would get there 30 minutes early before the testing site was open because we would have a briefing session. So during this briefing session, a lovely nurse would speak to us about everything we needed to know for our day. So this would be things like going over the protocols, which tents we were going to be in, the rotations we were going to have that day. We would go over the safety, making sure we knew the proper PPE and stuff like that. We would discuss going over how to properly swab the patients who were coming in and how to properly package the testing swabs so that they could go to the labs. And then we would also discuss how many appointments we were going to have that day. And so when I started in roughly November, we were looking at about 1,500 people coming in a span of only like 6 or 7 hours. So it was a lot to handle at one time. And then after the nurse would speak to us about health safety, we had a Union County police officer who would come talk to us about general safety while we're inside the tents. So that's making sure that when people come in, they park their cars because we don't want anybody stepping off the brakes accidentally and driving away. And then we made sure that we were in good communication with the police officers who were standing at the front of the tent and the back of the tent so we could have the efficient flow of the cars coming in and out. So the first day that I started, I was trained right on the spot that day, very nerve-wracking. The first thing that I learned was how to facilitate. So in the video that you saw, there were 2 people inside of the tent, me as a clinician, and then there was somebody at the table who is the one who packages the test. So when I first started, I was taught how to package the testing, and once I was comfortable, after an hour or so, I was taught how to do the clinician side of it, which is swabbing. When I learned how to swab, I was very, very nervous because I don't think a lot of people realize, but swabbing isn't as easy as it seems, because not everybody's nasal cavities are built the same way. Some people have very, very thin nostrils. So the main idea is that you're supposed to swab in a circular motion, but you can't always do that if somebody's nostril isn't shaped in the same way everybody else is. So making sure that I learned how to properly administer the test was very, very important to me. There was a long-standing idea that when people were receiving the test, they were painful. Sometimes people would go too far up. Sometimes people would have bloody noses when they were done. There were many, many complaints. So when I was learning, I really did try my best to make sure that each person was comfortable. And so I think that it's important for me to share some of the biggest lessons that I learned while I was at the testing site. And I'll just share two main things that I learned with you. The first is the importance of adaptability, which I think is very, very important in the healthcare field. You know, it's not just adults who are getting swabbed, it's children as well. And so, of course, children are not always the easiest to work with, but of course, we always do our best. So I think it's important when you're working with people of all ages to make sure that you're adaptable, you know? So sometimes children were hesitant to get the test, so we would make sure that mom or daddy got their test done first so that they could see, oh, it's not that bad. And then when they saw it, they were like, okay, I can do it too. And usually they would laugh or tickle because it tickled. Sometimes it was different, you know, sometimes the children handled it completely better than the adults did, which was always entertaining for me to see when the adults were squirming and the kids were laughing because they thought it was funny. Another thing that I think is important to mention is the fact that I learned a lot about body language. When people are coming to get their test done, we're talking about the height of the pandemic in roughly November. It was a scary time, you know, a lot of people were unsure about how this pandemic was going. So when somebody would come and they would roll down their window, you could instantly tell how they were feeling about the pandemic. So reading body language, I think is an important skill to have in healthcare just in general, you know, making sure that you're aware of how to react and how to treat the person that you're going to talk to. So at least from my experience, sometimes people were very hesitant because this is a pandemic and this test was likely the make or break of how they were going to be able to live their life for the next 14 days or so, give or take, depending on their results. So I really always did try my best to reassure the people who were hesitant and nervous, you know, try to offer them some type of support to make sure that they were okay. A lot of times I experienced people who simply wanted to talk to somebody, you know. I mean, I could only talk for so long, give or take, because we did have so many people, but I always tried my best to make sure that I gave everybody an equal amount of time to share their concerns, you know, share their troubles. Sometimes people were asking for information about COVID because the news did do their best to try to inform people, but I think sometimes it is better to get information from somebody who is on the front lines, who does understand the pandemic through their own eyes, you know? So I did try to offer the best advice that I could to the people who needed it. And I think another thing that's important to mention is the fact that Kane is diverse. And so because of that, we were able to offer a diverse set of medical professionals to be there during the testing site. As mentioned previously, the Black community has had a hard time when it comes to medicine and medical treatment. So you could honestly see the relief on some of these people's faces when they saw somebody who looked like me, who was there to administer their test, you know? They were more comfortable with themselves, they were more relieved, and they were more willing to work with me and ask questions and things like that. So I always did my best to try to help out whenever I could. And I hope that does give you a better understanding of the full entirety of what Kane did at the testing site. I hope that you got a good perspective from all of us. And so now I will hand it back to Dr. Tony.
Thank you, Selena. That was a wonderful job. And I'm sure those listening can see why we're so rightly proud of the work of our students and the dedication. So thank you, Selena. So Nate, we have a good amount of time for Q&A to the extent that we can. So I'm happy to open it up to the group. Can you hear me? Hi, Nate, can you hear me? Must be trouble with the connection. And please, I encourage everyone to post a question in the chat. And if Nate can help with access to your microphone, we'd love to hear from you directly.
I can hear you.
Okay, great. So any questions? Unfortunately, I think Nate is still having trouble with the connection. So Mohammed, if you could read that for the audience, please.
It is amazing to see what you accomplished in building your lab and also engaging your student population to provide an equitable service to the community. With the pandemic being an eye-opening experience to the public health crisis that is failing so many Americans, do you anticipate Kane will engage with the community in the future and offer services to decrease PH inequality?
Yes, well, I'll take that on briefly. As a senior administrator, absolutely. As Dr. Pyatt had mentioned, we have a longstanding close relationship with our local Union County Department of Public Health. I also personally belong to the consortium of scientists for pandemic preparedness. I encourage those of you out there to check out our website. It's just CSPP. We have members from Johns Hopkins, Harvard, MIT, Columbia, et cetera. It's a fantastic group of scientists. We're all doing our best to learn from the current pandemic to apply lessons for the future endeavor, and especially with healthcare inequality and overall disparities in healthcare. We have that in mind. So would anyone else like to add? Loretta?
So in addition, I mean, this presentation was very specific to how the university responded to COVID, but we have a community health major. So we've got students out in the communities looking at how to better deliver healthcare and social services, how to decrease the inequality in access and quality of services that are available. And we're working in a variety of different topics, including we're working on a national grant to look at maternal health. So we are doing that. We just didn't really talk about it this time around. I think that if you follow the Human Rights Institute and maybe join in on our conference, which will be in person, but we'll probably try to do virtually as well, we'll be talking a lot more about access to health in the spring.
Absolutely. But thank you for that question. I appreciate your good words. So Mohammed, I see we have another one.
I know Kane University has a campus in mainland China. I was just curious, the university was able to gain any experience from your colleagues in China that helped stimulate some of your early approaches to dealing with COVID-19 in 2020. Are there any plans to make your own experience available to help other places in the world?
Yes, so Edwin, that's a very insightful question. I appreciate that. I'll just share with you briefly, again, from my perspective as an academic and administrator, that as we all know, watching what happened in China was a few months ahead of what had happened in the United States, right? And ironically, very early on in early January of that year, we were frankly scrambling at the China site to quickly adapt to remote learning, because we knew that given the public health situation in the Zhejiang province and Wenzhou, where our campus resides, it wasn't safe at that time to have all the students return from different provinces in China. And so we very quickly adapted to remote learning. Many of us at that time, frankly, could not necessarily have predicted in any way what happened between January and March. Fortunately, we learned a lot about adapting to remote learning in a very quick period of time based on the curriculum that we were offering in China, which is the same curriculum we offer here. So that was number one. And then the second thing is with regards to contact tracing and the whole system of mitigating the transmission, we were paying close attention. Frankly, that could be a topic of a whole separate workshop because there was a lot involved in that. But anyone else like to add to that? No. Okay, but thank you, Edwin. You gave me an idea for a future workshop. Anyone else? And Nate, I hope you can hear us now.
Edmund said, I would love to join that too.
Excellent, great.
And yes, I can hear you now. Apologies for that. I live in the rural area, so occasionally my internet goes out, and unfortunately picked a very poor time to do that. So my apologies.
Okay, that's no problem. Nate, did you have any comment or perspective or question?
One question I had, and my apologies if this was already answered when my internet dipped out, was, what is one thing looking back that you'd wish you could have done differently? What is, one lesson learned that you've taken away from this experience?
Well, I would just start with the really profound observation that everything we showed you today would have been literally impossible had we attempted to do it on our own as an institution of higher education. I wouldn't necessarily do anything differently per se. I'm frankly stunned at how efficient and quick everything came together. I guess from my own perspective, there's nothing like a public health crisis and global pandemic to bring people together. It was truly extraordinary. Not to say in any way it was perfect, but I think it's going to take years, frankly, for all of us to reflect on what could have been done better. And we should all do that, again, to prepare for the inevitable next public health crisis that will come.
I think one of the things that this experience has shown the broader Kane community is that it really exposed the challenges that so many of our students have on a day-to-day basis that were kind of hidden when we were all able to come to campus. And we only through this experience did we realize how many of our students had unstable home environments or no home environments at all. How many students didn't have access to the internet. And so remote learning was even more challenging than for all of the rest of us.
And food insecurity.
Food insecurity went through the roof. We have an on-campus food pantry that we opened in March of 2019. I really want to put us back in the 1900s, clearly, that we opened in March of 2019. And we struggled with how to keep the pantry open and operational when, particularly in the early stages, when we didn't know how to keep our students safe, when testing, before the analysis was able to be done here, when testing was taking 5 to 8 days. So by the time you got your test results back, they had no validity at all, because between the time you had taken the test and the time that you were informed, you could have easily been exposed again. And so for those of us here at the university looking at things from more of a student services perspective, we realized that we needed to be much more dedicated to that. And as a result, what had been a division or an Office of Student Success and Retention is now a major division with its own vice president. We have a core of social workers that are supporting our students. And once again, we're partnering with Union County to provide social services to students who need them, far beyond access to testing, but SNAP benefits, housing, childcare, elder care. So those are some of the things that, not that we would have done differently, but were a unexpected benefit. Benefit's probably not a great word, but an unexpected opportunity to better serve our students. And then I think, in another conference, that would be a great opportunity to share with other colleges and universities.
Selena or Dr. Pyatt, would you like to add anything of possibly what could have been done differently?
Yeah, and from my perspective, really, Selena is an excellent example, because although, especially initially, we had planned ways for our students to get involved, I think we drastically underappreciated how many of our students wanted to contribute. We obviously had great experiences like you working at the testing site. I work with 10 students in a research perspective, as I described to you, but I consistently have students come up to me saying, how can I get involved with internships? Is there a student job I can have with the lab? Is there another way I can get involved? And that's, a year later. So I think while we did a good job initially of engaging students, I think in the long term, we could have done a whole lot more of that, not appreciating the demand that has been there, which from an educator is wonderful to see. So we have this wealth of interest and resources in our students that I hope we can continue to take advantage of.
I definitely have to agree with that. I know that at least from a bio standpoint, bio students, pre-med students were always looking for an opportunity to do something, sometimes to leave our resumes, I will admit, but also because we care a lot. And I think that before the pandemic came, didn't necessarily do the best job at giving bio students a chance to get involved. But since the pandemic, even I still have people who come up to me and ask me, okay, well, I saw that you were involved, how can I get involved too? I think that since then, Kane, like you said, really did take a notice that the students care, which I think maybe they didn't know before, but we really do care a lot. And so giving us the opportunity to do anything that we can really shows how much Kane is trying to make opportunities for their students now.
Great. Thank you, Selena. Thank you, Dr. Pyatt. Anyone else in the audience have any thoughts or questions before we wrap it up? No, but perhaps we were comprehensive then. So I do want to say, I should have said in the beginning, frankly, that I want to thank especially Jessica Wyndham and Teresa Harris for their gracious invitation. I want to thank the review committee that's selected our proposal for this important meeting. I'll share with you that I've been fortunate to attend every single meeting of the AAAS Science and Human Rights Coalition since 2009. I do miss going to DC and that beautiful auditorium and the AAAS headquarters. Hopefully next time we'll be able to go there in person and be able to meet you and your staff. But again, thank you, Teresa and Jessica, for your leadership. And frankly, both of you have inspired me as a scientist to continue my engagement in human rights. Really, it's a lifelong pursuit now. It's so clear to me how important it is for scientists and engineers to lend our skills, the ability that we have to help make the world a better place. So thank you, everybody. And I look forward to meeting you in person. Thank you, Nate.
Thank you.
Thank you, everyone.
Thank you so much, everyone. I just typed a link in the chat box. If you'd like to continue the conversation, please feel free to do so in the conference forum on the website. And thank you all to the presenters and the audience for your great questions. And we will look forward to seeing you back soon. We have a break now, and then we'll have a next plenary in a little bit. So thank you. And if I don't see you, enjoy the rest of your afternoon.
Thank you.
Thank you.
Thank you.